This is another interview. I'm interviewing Carl Stockton. He is the athletic trainer for UCLA. Can you give some more background information on yourself, Mr. Stocklin?
Yeah, sure. I'm a certified athletic trainer at UCLA, working with the baseball team. And prior to this, I was with men's water polo as well. So it's my 12th year at UCLA. Went to Michigan State University for grad school, where I worked with their baseball team and their wrestling team. Did an internship with Auburn University before that with their baseball team. And then I started out with University of Florida for undergrad.
All right. Thank you. Time to get into the questions. So, the first question was, what are some of the most common injuries you see with baseball players?
Yeah, so baseball is more chronic, long-term injuries. There's less acute injuries like you see with more contact sports. So the nature of how long the seasons are, um, the pitchers and catchers, how much they're throwing, they get a lot of shoulder and elbow injuries. So there's still a decent amount of lower body injuries just from them running, like ankle sprains and hamstring strains. And it is a rotational overhead sport, so mostly upper body, but we get injuries um, that relate to the rotational aspect, like your obliques and your abdomen. We get some strains there and some lower extremity, but it mainly is trying to keep their arms healthy.
All right. What would you say is more common? I know both elbow and shoulder injuries are common. Which one would you say is more common than like the other?
Yeah, so um, elbow reconstruction, the Tommy John procedure is an epidemic in professional baseball. So there's a um, better chance of coming back from that surgery than from shoulder labrum repair. But the elbow is it's a longer recovery. So um, I would say it's the data shows that you have a better shot coming back from Tommy John than from shoulder, but they're both very prevalent.
All right. The second question. What injuries are abundant but could be prevented if paid more attention to?
Yeah, so with baseball, the great thing about the sport is that most of the injuries can be prevented. Not every injury, you can't prevent every injury, but we do baseline screening with our student athletes to look at their range of motion and strength before the season, and we theorize that helps prevent injury if we see any red flags. So you want to go into the season with enough mobility in your shoulder and strength in your shoulder and elbow. So you can prevent these type of injuries, but the faster the pitchers are throwing, the harder it is to stabilize the elbow. So there are some injuries that you cannot prevent, um, like collisions or um, hit by pitch, but there are some gear, some protective gear the athletes can wear that if they do get hit by a pitch, it won't be as damaging.
All right. Uh, the third question is, how and why do injuries in the elbow and shoulder affect the player for like over time for like long term?
Yeah. So having one of those injuries, the greatest predictor of future injury is having the injury previously, so that the athlete is more likely to re-injure themselves in the same manner. So um, yeah, just it becomes what they have to work on throughout the rest of their career. So here in the collegiate setting, we have athletes come in from high school, and we want to make sure they have a good routine for taking care of themselves when they arrive to campus. So that includes using the lacrosse ball to roll out their musculature around their shoulder blade and their forearm, um, and just seeing what's worked with them in the past and what we like to keep or change. Um, but yeah, once an athlete um, does have an injury, they'll have to, especially with the shoulder and elbow, they'll have to stay on top of it and do a lot of preventative work for the remainder of their career.
Yeah. Uh, the fourth question is that in general, what's the best course of action to take when you're injured?
Yeah. So the best is prevention, but once you are injured, it's being committed to the rehabilitation and putting your body in the best position to heal. So um, a lot of that is low hanging fruit that maybe the student athlete doesn't have as part of their routine, like good nutrition and good sleep hygiene, and a dedication to the rehabilitation exercises. So, as an athletic trainer, it's nothing that I'm doing is healing them. It's just putting their bodies in hopefully as close to an ideal state as possible, so their body can heal itself. So that includes using therapeutic modalities in the rehab clinic and doing strengthening and range of motion exercises as well.
What would you say are some of the best, strength and rehabilitation like exercises that an athlete can do?
Yeah, so if you're just starting out, there's something called the Throwers 10 program, and that's kind of a basic um, strengthening. You can't go wrong with that classic series. And then there's an app for low back pain called the Back Doctor app from Dr. Watkins as part of the Watkins Randall scale um, of lumbopelvic health. So um, the throwers 10 is a little too simplistic for our athletes to try to make sure that we're giving them individualized care. But for the Back Doctor app, um, I have recommended that for patients with low back pain because it's on a scale. So um, you're progressing as you get more competent in each exercise, and um, we've had good success with that one.
Right. The next question is, what practices to prevent injuries are often like overlooked?
Yeah, like I said, with the low hanging fruit, people can they may not appreciate that as part of their game. Um, one year we had athletes use the Whoop band for looking at their sleep scores, and um, it's tough being as you know in high school and going into college to try to put everything on your plate and still study and extracurriculars, sports. So um, I think sleep gets forgotten or not prioritized, I should say, compared to maybe some other um, ways that people think are healing themselves. So um, yeah, I think a lot of the athletes have inflammatory diets as well. So if you have a inflammatory condition like biceps tendonitis, where the tendon is inflamed, if your diet consists of fried foods and sugary drinks, you're not putting your body in the best position to decrease the inflammation. So, like when athletes have tart cherry juice before bed to improve sleep duration and decrease in inflammation.
All right. And should athletes play through their injuries? Is the next question.
That's a good question. We use this one scale called the Tampa scale for kinesiophobia and fear of movement, and it kind of it gives us a look into the athlete's mindset of if they think it's safe to return. But for me, as part of the sports medicine staff, I will always advocate for the student athlete's health. So there's pressure from coaches to return, and many times the athlete wants to return before they're completely ready. But it's my job, as well as the rehabilitation director and our team physician, to make the right decision for the student athlete. So um, with that said, it is the athlete's ultimate decision, but we will hold them out if needed. So if we give them the option of returning before they're completely healed, we talk about the risks, and it's often specific to the season. If the athlete is wants to come back for an important game, and the sports medicine staff deems it medically safe, that's conversations that we have with the athlete and the coaches.
Right. And one more question before I let you go. What has been the craziest injury that you've seen throughout your career? Like, yeah.
Yeah, so it was a um, kind of a high pressure moment of being at Dodger Stadium, UCLA versus USC, and um, the batter hit it about 100 miles an hour, line drive off our pitcher's face, um, and he went down. A lot of blood. Um, Televised game, so um, that was startling, but my instincts kicked in, and um, we took care of the student athletes. So um, I think when the stage is big, it can be more pressure, but in the medical profession, you'll learn that your instincts kick in when they need to.
All right. Well, thank you for this interview. I wanted to keep it quick so you can, get back to the game. Good luck today. Hopefully you guys
Thank you,
win.
Oscar. Appreciate
Yeah,
it. Have a nice day.
you too.